Cytarabine Vial is a medication used to treat different types of cancer. It is a chemotherapy drug that works by slowing down or stopping the growth of cancer cells. It is important to follow the dosage prescribed by your doctor and take it at the recommended times for the best results. When using Cytarabine Vial, it is typically administered through a vein by a healthcare professional. The dosage will be determined based on your medical condition, body size, and how you respond to the treatment. It's important to stay hydrated while taking this medication, unless your doctor advises otherwise. Drinking plenty of fluids can help your kidneys eliminate the drug from your body and may also reduce the risk of experiencing certain side effects. Some common side effects of Cytarabine Vial include nausea, vomiting, loss of appetite, diarrhea, headache, dizziness, mouth sores, and pain/swelling/redness at the injection site. If you experience severe nausea and vomiting, drug therapy may be needed to prevent or relieve these symptoms. Making changes to your diet, such as eating several small meals or limiting activity, may help lessen some of these effects. Temporary hair loss may also occur, but normal hair growth should return after treatment has ended. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, you should tell your doctor right away if you experience any serious side effects, such as signs of liver problems, muscle/bone pain, chest pain, shortness of breath, vision problems, painful/difficult swallowing, signs of kidney problems, joint/side/back pain, numbness or tingling of hands/feet, or mental/mood changes. A very serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. This medication can decrease the function of your bone marrow, which may result in a low number of blood cells, including red cells, white cells, and platelets. This can lead to symptoms such as tiredness, pale skin, signs of infection, such as a persistent sore throat, fever, chills, and easy bruising or bleeding. If you experience any of these symptoms, it is important to inform your doctor immediately. Before using Cytarabine Vial, make sure to inform your doctor or pharmacist if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Also, be sure to tell your doctor or pharmacist about your medical history, especially if you have decreased bone marrow function, blood cell disorders, liver disease, kidney disease, or gout. Cytarabine can increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has an infection that can easily spread, like chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to talk to your doctor for more details. Additionally, let your healthcare professional know that you are using Cytarabine before getting any immunizations or vaccinations. It's also advised to stay away from people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the chance of getting cut, bruised, or injured, use caution with sharp objects like razors and nail cutters, and avoid activities like contact sports. Cytarabine may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. Limiting alcoholic beverages is also advised, and if you are using marijuana, be sure to talk to your doctor. If you are planning to have surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For women, it's important to inform your doctor if you are pregnant or planning to become pregnant. Using Cytarabine while pregnant can harm an unborn baby, especially in the first 3 months of pregnancy, so it's important to ask about reliable forms of birth control while using this medication. It is unknown if Cytarabine passes into breast milk, so breastfeeding is not recommended while using this drug. Be sure to consult your doctor before breastfeeding. When taking Cytarabine Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cytarabine Vial include digoxin, flucytosine, and gentamicin. Be sure to discuss any concerns with your healthcare provider. If you or someone you know has taken too much Cytarabine Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include confusion and changes in mental or mood. It's crucial to act quickly in these situations. During your treatment with Cytarabine Vial, it's important to have regular lab and medical tests to monitor your blood counts, liver and kidney function, and uric acid levels. Make sure to attend all your medical and lab appointments and consult your doctor for further information. Make sure to take each dose of Cytarabine Vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist for a new dosing schedule. This medication is used to treat certain types of cancer and should be taken at the recommended times for optimal effectiveness. Be sure to follow the storage instructions provided with the product and ask your pharmacist for any additional details. Always keep medications out of reach of children and pets. Do not dispose of medications by flushing them down the toilet or pouring them into a drain, unless specifically instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to properly dispose of the medication, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.